Hello everyone, my name is Vicky Kennedy. I am the Regional Knowledge Coordinator for Chronic Disease Management and Primary Care. Over the next several minutes I am going to present the recent changes made to the diabetes documentation tools. As of Tuesday, October 13th, 2015, the newly revised CDM Meditech documentation tools will be live. These include the Diabetes Assessment, Diabetes Progress Note, Diabetes Recommendation Management Plan, and Diabetes Educator Consult Note. All of the feedback from clinician testers was reviewed and have been accommodated where possible. The changes have been made based on your recommendations and will replace the old. We will briefly go through some of the changes made in the tools to complement the process guideline and frequently asked questions resource documents available in the diabetes page on the Inside Net. In the Diabetes Assessment tool, the following changes have been made. Visit information now has 3 sections within it. They are Visit Reason. The list of classes has been removed from this field. Visit Information and Client Concerns. In the previous assessment tool, Client Concerns was located at the end. These sections open automatically. Medical and Social History now has 3 sections within it. They are Diabetes Diagnosis. In the old assessment, this was located in Diabetes History. Medical History. The conditions listed here have been minimized. Social History. Some fields have been changed or amalgamated here. In the Social History, more detail has been added to quitting smoking as required by Interior Health, and there is one general comments field at the end of the section. Physical exam, investigations and vaccinations has been moved up in the flow of the revised assessment tool. Data in this revised section has been amalgamated from health history, the anthropometrics, physical exams and vaccinations, and the current blood glucose level sections, diabetes lab tests, in the old tool. There have been some changes made to language in the diabetes lab test field, and lipid profile data can now be entered here. Sleep, physical activity, and nutrition have their own section now and have also moved up in the flow of the revised assessment tool. Sleep and physical activity comments are now combined. So as you can see, the tools have evolved with the revisions made. Some of the general changes across all tools include more free text, combined comment sections, information required has been condensed, and some of the language has changed. The nutrition section has been modified and consolidated. Blood glucose and ketones now has 2 sections. The first section, blood glucose monitoring, combines data from the blood glucose monitoring, current blood glucose levels, and lab information sections of the old assessment tool. The hypoglycemia section is now located with blood glucose and ketones and has been modified. Current medications is a new name and includes diabetes and other medications. Remembering vaccinations is now located with physical exam and investigations and will be captured earlier on in the assessment. A free text field has been added for anti-hypoglycemic agents, and there is now just one general subcutaneous insulin comment field. The insulin pump section now contains a consent field to access pump e-data. Total unit fields have been changed to average daily units. Other medications and supplements can be entered in the Other Medications field following insulin pump. The pregnancy section is now renamed Diabetes and Pregnancy Assessment. The order of data collection has changed and some fields have been moved around within the Diabetes and Pregnancy Assessment. Obstetrical history is now divided into two sections, obstetrical history and current pregnancy. In current pregnancy, weeks of gestation can be auto-calculated from expected date of delivery. Diabetes and pregnancy lab tests is a new section, and anthropometrics is now named Diabetes and Pregnancy Anthropometrics. Note that the current weight must be entered in the general anthropometric section. The nutrition section here is unchanged. Assessment has been renamed Clinical Impressions and includes nursing and dietitian notes. The client's self-management goals are to be entered in the diabetes management plan, which should be initiated or updated following all assessment or progress notes. In the contact information, other provider present has been deleted from this section as it is already captured in the visit information section at the beginning of the assessment. The other providers present field has been removed as it has been determined by the professional practice office that it was not needed. This is to ensure that only one provider charts on the diabetes assessment. Change is continuous and sometimes we are resistant to it, but if we accept the change, we can welcome the possibilities. The tools are similar with the same components. We like to think the newly revised tools are more user-friendly, easier to work with, and more relevant. Moving on to the revised diabetes progress note, there are significant changes from the old progress note, but the section format and flow is similar to the assessment tool. The diabetes status markers sections have been removed and diabetes diagnosis and visit information is captured again as in the assessment. From visit information, you then move on to current medications in the blood glucose and ketone information sections. These are similar to the assessment form. A diabetes and pregnancy assessment section completes the assessment with a free text section for clinical impressions. Next is diabetes assessment, which has three sections: diabetes lab tests, vitals, physical exam and anthropometrics. All current weights are entered here, pregnant and non-pregnant clients. And the other section is additional assessment information. The additional assessment information section of the progress note contains 4 fields for free text. The diabetes and pregnancy assessment of the new progress note contains 2 sections: delivery and gestational date information and diabetes and pregnancy lab tests. There is one clinical impressions field for the clinician completing the progress note. The clinical impressions box can capture both clinical impressions and any service or activities done during the visit as clinicians may want. However, future recommendations should be noted in the management plan as recommendations care plan, which would be initiated or updated following the progress note. We cannot expect something different by doing the same thing we have always done. In order to achieve improvement, we have to be willing to innovate and adapt. This picture pasture is Wadi Rum in Jordan. They have started organic farming 720 square kilometres in the middle of the desert. Please remember that there are also 2 documents that will be able to support your transition to the new tools. The process guideline and frequently asked questions are located on the diabetes page in clinical care resources on the inside net. The next documentation tool has had a name change to accommodate the order that it will appear in the work list and is now called the CDM Diabetes Recommendation Management Plan. There are several changes to the language, sections and fields. The plan now contains more detail. Diabetes diagnosis has been removed. Diabetes report status and clinicians present at the meeting are now the first 2 sections. The diabetes plan of care is now removed, replaced with care plan further down in the documentation tool. Medication recommendations is a new section of the tool and follows the same format as used in the other documentation tools. The care plan section contains 3 fields: other recommendations and care plan, pregnancy specific plan, and next appointment. The client action plan field is where brief action planning and motivational interviewing is documented, with the client's own self-management goals recorded. The client's confidence level of achieving their personal goals is documented in the field below. The pregnancy-specific plan is where all non-medication recommendations and care plan information for pregnant clients is documented, including the labour and delivery plan at the 34 to 36 weeks gestation visit. Simply type labour and delivery plan, then the notes in this field at that visit so it is clear and can be referred to. The next appointment is a new section where details of the follow-up plan are captured. Diabetes plan of care status has been renamed status and clinician contact. If the diabetes team is initiating or updating the recommendation management plan, the clinician name and credentials at the end of this tool is the clinician logged into Meditech and takes on the role of the scribe, documenting on behalf of the team. The last documentation tool to show you is the Diabetes Educator Consult Note. This will be accessible to any facility or program noted as a possible consult service facility. It replaces the Acute Diabetes Educator Progress Note. Please refer to the process guideline. This will provide support on when to use the document. We have added more fields to capture detailed information for each consult. You will notice the consent field is included on this tool. As you can see, it is a brief tool to document care under specific circumstances as described in the process guideline. Please note that clients receiving ongoing care as part of the diabetes education program should be assessed using the other CDM diabetes documentation tools. Finally, in the work list, the new assessments will have V2 or version 2 attached to them, which only shows up when adding a new assessment. That concludes the presentation. If you have any questions, please feel free to contact me at vicky.kennedy@interiorhealth.ca. Thank you.